Show with Chris Stigall.
Hey there, I'm John Holt, co-anchor of Fox 4 News at 5 and 9. If I don't see you out at the K or on the plaza, I'll see you here at 5 and 9 or on the web, myfoxkc.com. As a matter of fact, if you have any good story ideas, john.holt at foxtv.com. Stand by. Time to go to work.
He really is. He is everywhere. I rolled over this morning, John Holt, right there in between my wife and me. He is that committed to being everywhere you are at all times.
You're a snorer. I didn't realize you snored. Talk to your wife about that.
Fox 4 is John Holt. You see him every night at 9 o'clock. You worked last night.
I did.
No Labor Day off for you.
No, we were laboring. We say working for you. I was laboring.
Every night.
Every night.
I do. You and Susan, you know what I love about the 9 o'clock newscast for people like us that go to bed earlier? We got to get up a little earlier. We
have to wait up.
Yeah. I routinely will turn you off at night. That's the last image I see before my head hits the pillow.
You're not the first person I've put to sleep. Trust me.
And you brought your doctor in, which is
did.
unusual. You travel with your own. This is how big anchors get. They're like the president. They have their own doctors in tow. Dr. Brantley Thrasher. He is out there at the University of Kansas Medical Center. And you and Dr. Thrasher came to know each other, I'm sure, John, because of circumstances you'd rather not have had happen to get to know Dr. Thrasher. But it all turned out well in the end. That's why you're here.
Well, we're hoping so. Anyway, right, Brand? Absolutely. I had an opportunity to meet Brand, although I knew who he was because of our health reporter, Marilyn McCain, who had interviewed him a time or two. When my PSA levels, we'll talk about that. I'll let the good doctor talk about that. When my PSA levels jumped up a little higher than my primary care physician liked and sent me down to KU for a biopsy.
Now, this is one of those things that I hear men have happened pretty regularly. I mean, this is one of these PSA levels, and I mean, dependent upon the severity of it. Generally, 30,000 foot view, what are we talking about here, particularly as it relates to men?
Well, 1 in 6 men will develop prostate cancer. So
1 in 6.
Absolute big health issue for men. I think that men have done a very poor job compared to women of getting the message out there. That's one of the problems. Women will talk about breast cancer. Men just don't like talking about their health issues, don't like talking about prostate cancer. And because of that, I do believe that we're a little behind the 8 ball compared to the female counterparts in their struggle with breast cancer.
Is it? I mean, men in their 70s. I have heard many men diagnosed with this, and doctors say, correct me if I'm wrong. Look, it's a fairly slow to develop cancer. It's not the most aggressive kind of cancer. So, older men that are diagnosed with it are often just kind of left with it, and told that sometimes, in some cases, their age will take them before the cancer will.
You know, that's absolutely true. If you look at the numbers, most men will develop prostate cancer if they live long enough. The difference is, what's the grade of the cancer? How aggressive does it look under the microscope? So that's a piece of information you have to know. The PSA level, what they find on digital rectal examination when they examine the patient, and your age and health. Now, if you've got a guy like John here who's a picture of health, younger gentleman, then you've got a little bit of a problem. Then we need to take care of this and start talking about some type of therapeutic approach. What are we going to do to take care of older men, especially low-grade cancers? You're absolutely right. We can do active surveillance.
Now, yours was surgical, John. You ended up having to have the surgically removed.
I did. We had options. Dr. Thrasher gave me several options that we could approach this therapeutically. We chose the surgical route because, as you explained it, Brant, we would have radiation in our hip pocket if we needed it. Okay, if the cancer, if we find that it's spread, you know, we don't know yet. We'll find out soon, but hopefully we got it all. But I'll have that as a follow-up if I need it. We did the robotic Da Vinci laparoscopic procedure, which is major surgery, right, Grant? I mean, it is. I was out of work for 4 and not able to do much for 6 weeks, and I'm still recovering. But the blood loss is less, the recovery time is quicker. Instead of 1 major incision, it was 5 little ones. It's amazing the advances these docs have made in terms of being able to treat.
And this was your general practice doctor that caught the PSA level thing?
Yes, I have regular blood profiles done because I'm on a statin for cholesterol every 6 months. And one of the screens is a PSA. And I know there's been some discussion about, you know, the worthiness of PSAs and at what age you should do it. But it was a regular part of my blood screening, and he noticed over time it was kind of jumping up and down. And then it took a big enough jump that he said, I don't think you have a problem, but let's check it out. And that's when he sent me to Dr. Thrasher at Keene.
See, as a younger man, that's something I would guess most of us doctors don't even look at. or think to ask about, and even if we did, then maybe we wouldn't catch it. As he said, his doctor wasn't even all that concerned initially.
You know, it's interesting. I think that one of the problems that we see is there's been so much published about PSA being an imperfect marker. And interestingly, in John's case, I think that that's case in point that, yes, one particular PSA probably acts more like height or weight. There is no PSA below which you can say, you absolutely don't have cancer. What we know that's important in PSA is get the PSA early. Generally, the AUA guidelines now say at 40. And once you do, follow it every year, because it may be more important that PSA velocity or PSA rate of change on a yearly basis than just the number itself.
So if you're a male and you're saying 40 is a good number to start?
Absolutely.
Just walk in and say, Doc, I'm here for my annual and I'd like to know what my PSAs are. Is that right?
I think that we need to have discussions about that. What does this PSA mean? What else do I need? Usually a digital rectal examination as well as a PSA. But I think getting that first PSA is critically important, and the high-risk patients, African Americans, men that have family members with a prostate cancer diagnosis, or patients that are running a little bit higher PSA if you've had one in the past, those are high-risk patients.
And you had no symptoms, John, other than just the high PSA. You didn't know anything about
I had a slightly enlarged prostate, and in fact, the initial diagnosis was prostatitis, that it was probably nothing but an enlarged prostate. However, as Dr. Thrasher mentioned, I was in that high-risk group. I have a father who had prostate cancer, had his removed, and I had a grandfather who died of the disease. So I knew at some point, it was on my radar. I kind of figured, oh, I'll be 65, 70, and then we'll have that watchful waiting approach to deal with, or depending on how aggressive it is, maybe take it out then. I had no idea that at my age now, 38 and a half, give or take a few years, actually, 51. All right, I'm 51. I'm thinking I'm still too young.
Very young.
But you know what? You're not. And with these new ways to screen for it, it just, why not? Why wouldn't you at least have that baseline to look at? And then you can decide what your options are.
Yeah, you're right, Doc. We men don't look under the hood nearly as often in general as we should anyway, do we?
No, I don't think that's one of the problems, is that men would like to ignore it. I hear all the time, you know, I'm the primary breadwinner. I don't have time. I feel good. That's one of the critical problems, is prostate cancer usually doesn't give any signs that it's there until very late in the disease.
And how aggressive is it? And if caught early, obviously things look pretty good.
Generally, it is a fairly slow-growing cancer, the majority. But there are some aggressive prostate cancers. If it's a Gleason grade, the grading system, you look at it under a microscope and say, how close does this compare to normal prostate tissue? The higher Gleason grade cancers can be very aggressive, but generally not.
John, we're glad you're well, and you'll get a clean bill of health here soon, we hope, right?
We hope so. Maybe this week. We'll see.
Yeah,
I'm back. I'm back for a screen this week to see Dr. Brandt. Hopefully, good news to follow.
John and Doctor, thank you for the important information. This, again, something we men don't talk a lot about, but if people want more, or...
Well, let me just throw out one idea. First of all, Brent, go ahead.
Well, I'd like to let you all know that we do have a high-risk prostate cancer clinic. Burns and McDonnell have been generous. University of Kansas started off with a very large grant that will support this. We're kicking that off on September 17th. High-risk patients, high PSAs, previous biopsies in the past, African-American men, high-risk men, family members that have prostate cancer. We're going to have a screen that will be supported by that grant down at the Cancer Center, and we're kicking that off on the 17th. So if you want to know more, call KU Med, the Cancer Center there, and get more information.
Okay, fantastic.
And I've got a buddy I connected with while I was recouping, a fellow by the name of David Emerson here in town who had prostate cancer. And he started a foundation called Faith, Love, Hope, Win. And they're going to have a golf tournament coming up on September 24th out at Iron Horse. They have a few slots left. Faith, Love, Hope, FLHW.org if you want to get involved and learn more about that. And it has a lot of useful information and links to other prostate cancer information. Dave Emerson is a survivor as well, and they're raising money for prostate cancer research and awareness. And that's what it's all about. And I think Prostate Cancer Awareness Week is coming up, right?
Absolutely. It's Prostate Cancer Awareness Month this September.
Okay.
So it's a great time to be talking about it.
Guys, thanks for calling attention to it. We appreciate your time. And John, God bless.
I'll keep you posted.
Will you?
Thanks, Chris. Yeah, absolutely.
You're our thoughts, my friend. It's 7:48.